I'm very excited about this. It's something that we have developed over the last 24 years. And it's different than what happens in most of psychiatry. So in most of psychiatry, you have a group of symptoms, and then they give you a diagnosis, which is often a regurgitation of the symptoms, and then they treat the symptoms. So for example, you have depression. They give you a diagnosis called depression, and they give you a medicine for depression. Or say you're anxious, and they give you an anxiety disorder diagnosis, and then they give you anti-anxiety medication. Or you have attentional problems, and they give you a diagnosis of attention deficit disorder, attention deficit hyperactivity disorder, and then they give you medicine for attention. Or my favorite one is you have temper problems. You explode intermittently. We actually have a diagnosis called intermittent explosive disorder. I love that. Think about the acronym for that, IED. Sort of fits. And then the treatment for that is, I don't know, it's anger management classes or some medication. It doesn't work. I mean, that's sort of the sad thing. Tom Insel, director of the National Institute of Mental Health, wrote recently that we have no better outcomes in psychiatry than we did 50 years ago, because this method or this mode of diagnosing and treating people does not include any biological information. So at the Amen clinics, we do brain scans. We have been doing brain Spect imaging for the last 22 years. We've done over 81,000 studies on patients from 93 countries. And the reason they come to us is we have a very specific, very different method. Now, of course, you have to talk to people. In fact, we do very detailed histories. And what's important to us is to have what I call our four-circle model, which is a biopsychosocial spiritual model. So we get biological information on people. What are your genes? What illnesses run in your families? Have you had a head injury or toxic exposure? How's your diet? What's your level of exercise? We also get psychological information. How do you think? What significant developmental events have happened in your life? And then your social circle really does matter. Who do you hang out with? How's the health of the people you spend time with? What are your current stresses? What's your current social situation? And the spiritual circle, which a lot of psychiatrists, they don't want to touch, but we think it's very important, which is, why do you get up in the morning? Why do you care? What's your connection with past generations? Like my grandfather, what's your connection with future generations? Like my grandson, what's your connection with the planet and with God? 80% of the population has very deep-rooted spiritual beliefs. It's important to understand. So biopsychosocial spiritual history, so we want to know that information. So we do a study called brain Spect imaging that looks at blood flow and activity. It looks at how your brain works. It's a wonderful study. It basically tells us three things: areas of your brain that work well, areas of the brain that are low in activity, and areas of the brain that are high in activity. So for example, if you have symptoms of depression, well, we want to know, what does your brain look like, so we can give you a more personalized, specific diagnosis that's your type of depression. I've written books describing 7 types of anxiety and depression, 6 different types of addictions, 5 different types of overeaters, and 7 types of ADD. Because based on imaging, having ADD isn't one thing, or having depression isn't one thing. You give everybody the same treatment, you make some people better, but you make other people dramatically worse. So 4-circle evaluation, imaging, and then targeted lab studies. I always say, you cannot change what you don't measure. And I need to know about how your red blood cells are, how your white blood cells are, how your thyroid is, how your liver functions? Is there a sign of inflammation or toxicity? How's your blood sugar? All of those things matter to the health of your brain and the health of all 4 of those circles, really. So the 4-circle evaluation, imaging, labs, and what that leads is to more specific, personalized diagnoses and more targeted treatment. And we're very excited about this method because it improves outcomes. We actually study all of our patients who come to the Amen clinics. On average, our patients have 4.2 diagnoses. They've failed 3.3 providers and 6 medications. So they tend to be complicated. So when they first come, we do some very structured intake measures that are standard, scientifically valid, and then we call our patients at 6 weeks, 3 months, and then at 6 months, and we re-administer some of those same measures. And at the end of 6 months of our complicated patients, 75% are better across all measures. 85% their quality of life goes up. Now, we're really excited about that because these are the best outcomes in psychiatry that we're aware of people who actually publish their outcome studies. We also published another study that when you get a scan, it actually changes what the doctor does 78.9% of the time, so nearly 80% of the time. And that's very important. So the method is a detailed history, but also the imaging, because again, how do I know unless I look? For example, 22% of the time we saw patterns for brain injury that were not reported in the history. It's probably the single most important thing that I've learned from looking at scans is that mild traumatic brain injuries ruin people's lives and nobody knows about it because people aren't looking at brain function. As we get this information and if we looked at all these scans, it really has given us a couple of very important guiding principles for the brain. The first one is first do no harm. I mean, I know we learned that in medical school, but when you start looking at the scans, you realize a lot of the medications are not good for the brain. And a lot of bad habits, like being overweight or having hypertension or diabetes, they're bad for brain function, which really leads us to the next principle, which is using the least toxic, most effective treatment. So we like using natural supplements whenever possible. Now, we use medication when we think it's the most appropriate thing to do, but in our mind, we're thinking least toxic. So if we can use certain supplements, SAMe, 5-HTP, fish oil, as a way to help our patients, we do that, but in a targeted way. The last thing we do, which to me may in fact be the most exciting thing we do, is in addition to this, we also try to boost our patients' brain reserve. So it's an interesting concept. When we're born, we usually have a lot of reserve, but our life begins to take it away from us. If you fall down a flight of stairs, that steals some of your reserve. If you start smoking pot in high school, or you start smoking cigarettes, or you drink, or you play football, or you're hitting soccer balls with your head, all of that is stealing some of your reserve, so that by the time you're symptomatic, you've sort of taken away all your reserve. Think of it this way. Take, for example, 2 soldiers in Afghanistan, both in the same tank, both exposed to the same blast injury. One soldier walks away unharmed, the other one is permanently disabled. Why? Well, it has to do with the level of reserve they started with when they were exposed to the blast. So one had a lot of reserve, so when he lost some reserve but still wasn't symptomatic, one didn't have very much reserve and became very symptomatic. So our job, not only in diagnosing and treating our patients, we want to boost their reserve so they're better than before they were sick. We're really excited about what we do at the Amen clinics. I hope you stay and learn more.